So I visited with Pam a couple years ago. She loved the idea. We went to work on it, and the surgeons here, your community surgeons in Yankton, are very, very fired up about it. And they're going to be an integral part of training our residents. There will be residents here spending 2-month intervals during their 2nd and 4th year here, such that and there's 3 per year, such that by, I think in 3 years we'll have someone here year-round. So there'll be a general surgery resident here year-round, learning fundamental, basic general surgery to help fill that void that nationally we haven't been able to do. Is there a need for this? We were very proud about this. We have 6 slots. We had no clue when we put our name out there that said we have a new program. The residents and the medical students apply for this to get into this program. Any idea how many people applied for 6 spots in the United States? Close to 700. Wow. You know, that spoke to a dramatic need, we thought, nationwide, of people interested in doing what we are doing. And we were kind of the buzz nationally about this because of that enthusiasm. It's easy for me to be energetic because I have such a phenomenal faculty. You mentioned faculty that wants to do it. Dr. Serck was on board with this a moment. He said, when are they coming? I mean, literally, the first day we said it, he said, when are they coming? And I said, we have a few hoops to jump through, but we can do it. And he's been on board the whole time. And then all of his colleagues.
I don't think it'll change anything with, you know, my practice or our practice with the hospital as far as, you know, what we do. But I think it'll make your, I don't know if fulfillment's the right word, but you know, you come to work, you do the same thing every day, and you know, sometimes having more with you're teaching somebody and you're maybe going to make an impression on them and make them good doctors, I think can have a lot of solid feelings. I guess it's not the right word, but we feel good about teaching, leaving an impression, helping somebody get better.
Just something felt really right about the autonomy that they're going to be able to give us, being involved hands-on in the surgical care, but also the support. And I didn't necessarily find that balance anywhere else as well in the programs I saw. So I was really excited to come here, and it's a bit of a change because I've lived my whole life in Chicago, but everything's worked out better than expected, so I'm really happy to be here, really grateful.
And I did a year last year in Des Moines, so not too far away from here, only a couple, 3.5, 4 hours or so, and there was several faculty that are up in Sioux Falls now that trained in Des Moines, and people that have worked in both places, and had a lot of really good things to say about the organization at Sanford, and that they've kind of been a fine old machine for decades up here. And I always think of myself as a Midwest person from Kansas, and then trained some in Iowa, and then now I'll be in South Dakota. So I think that's more of, I think when you look for a place to train, you try to find a place that's your lifestyle too. If you're from the East Coast or West Coast, training at UCLA or Temple or somewhere like that, that's probably more fit for your personality. I'm Midwest and like Midwest people, and this definitely had a feel like that. It's very fast-paced, but it's not too big and cumbersome like some other places can be.